When infected with tetanus, very serious complications, both early and late, can develop. Early complications include pneumonia, muscle ruptures, bone fractures, as well as inflammation of the heart muscle and blockage of the pulmonary artery. With spasms of the glottis, respiratory muscles, and diaphragm, asphyxia occurs. Respiratory arrest takes place. This can lead to death as well as if medical assistance is not provided in time. Late complications are bed sores, deep vein thrombosis, and spinal deformity. Many patients manage to survive tetanus and fully return to normal life. Full recovery occurs within 2 to 4 months. Sometimes reduced muscle tone persists. Convulsions are so strong that they lead to dislocations, bone fractures, muscle ruptures. If a person has symptoms that resemble tetanus, they should be taken to the hospital immediately. The doctor establishes the diagnosis after examination based on a distinctive clinical pattern. Symptoms may be similar to diseases such as rabies, strychnine poisoning, and underactive thyroid glands, but trismus and an anguished smile are unique to tetanus. Laboratory studies aimed at detecting the pathogen are not required. Diagnosis of tetanus by laboratory tests will not give any result. A blood test for toxins and antibodies cannot detect infections due to a low level of antigenic stimulus. The study begins only after the manifestation of the disease symptoms, visible tissue disorders. But here, too, the diagnosis itself is rather secondary and can only confirm the diagnosis already identified by the signs inherent in tetanus. As soon as the patient is delivered to the clinic, he or she is immediately placed in the intensive care unit and treatment begins. The remaining spores of the tetanus bacillus are immediately removed, and the further spread of the toxin in the body is prevented. To do this, surgical treatment of the wound, which has become the entrance gate of infection, is carried out. A mandatory measure for suspected tetanus is the intramuscular injection of human tetanus immunoglobulin. This drug is an antibody that neutralizes tetanus toxin. This is called passive immunization. It gives, albeit short-term, but instant effect and saves lives in most cases. The production of antibodies is a long process, and they are necessary precisely at the height of the disease to bind the toxin. Emergency prevention should be carried out in unvaccinated or improperly vaccinated people when receiving any mechanical damage to the skin, whether it is a wound from the nail in the foot or the prick of a finger with a rose thorn. To do this, an anti-tetanic serum is administered as early as possible. An important element of treatment is seizure management. Patients are administered antipsychotics, tranquilizers, muscle relaxants. Antibacterial therapy in tetanus treatment is of secondary importance. Antibiotics can be prescribed to prevent infectious complications, pneumonia, and blood poisoning. Artificial ventilation of the lungs is carried out in violation of breathing over a long time. Even today, a patient with tetanus requires incredible efforts from doctors, nurses, and all attendants to prevent the threat of death. According to many experts, tetanus has aged significantly in recent years. Scientists point to significant contamination of soils on the territory of livestock farms with tetanus bacillus. A high prevalence of tetanus in Western countries is recorded among older immigrants, who are usually not vaccinated. The medical literature describes an example of human infection with tetanus. Fortunately, the case was not serious and the patient recovered. A 78-year-old man from Mexico went to the emergency room complaining of jaw pain and abdominal distension in the previous 3 days. Analyzing his medical history, doctors discovered hypertension, that is, high blood pressure, although he had not previously suffered from it and did not take any medication. It was obvious that the patient had difficulty opening his mouth. On examination, he was not in pain, but he felt discomfort when the medics tried to open his mouth by force. When examining the body in the area of the right forearm, the doctor revealed a healing wound. The patient stated that he fell from a tractor into dirty water 2 weeks ago and was injured. He confirmed that he was immediately examined by a local doctor who treated the wound. When asked about immunization status, the man said he did not receive tetanus prophylaxis during the wound treatment and admitted that he never received any shots. The doctors diagnosed him with tetanus. The wound was cleansed. In accordance with the recommendations of the CDC, doctors administered tetanus immunoglobulin and a tetanus vaccine. But the other patient was not so lucky. A 42-year-old farmer man, a week after his index finger was wounded by a chip from an old wooden bed, went to the doctor with complaints of fever, difficulty swallowing, and pain in the injured finger. When examining the patient, attention was paid to tachycardia, tension of the muscles of the occiput, and trismus of masticatory muscles. The diagnosis of tetanus was established immediately. The patient was hospitalized in a timely manner and treatment was started on time, including the administration of serum. The outcome of the disease was, however, unfavorable. The case turned out to be fatal, and, despite the efforts of doctors, the patient did not survive. Teenagers often become victims of tetanus, especially in the summer. In the medical literature, for example, the following case is described. A boy, 11 years old, living in a rural area, stepped on a nail in the summer. The parents immediately brought the child to the local hospital where the foot wound was surgically treated and tetanus toxoid was injected. The child had not been previously vaccinated against tetanus, as the mother was opposed to vaccination. The first day, the boy felt satisfactory, but on the 8th day after the injury, his condition worsened. There were difficulties in opening his mouth, trismus of masticatory muscles, inability to eat solid food, pain in the back muscles. The manifestations of these symptoms increased, and on the 11th day after the injury, the child was hospitalized in the infectious department. But the boy's condition continued to worsen. Insomnia appeared. Cautious reacting to loud sounds, pain syndrome in the muscles grew. The condition was severe. The child was conscious, psycho-emotional anxiety was noted, complaints of back pain, pronounced muscle hypertonicity, shortness of breath. He could not even swallow saliva. Based on the anamnesis and clinical picture, the child was diagnosed with wound tetanus, generalized form, severe form. Considering swallowing difficulty, trismus of masticatory muscles, inability to open the mouth, a probe was placed and tube feeding was started. Anti-tetanus serum was also introduced. Over the next 3 days, a gradual decrease in hypertonicity was noted. The child began to open his mouth. The intensity of the pain syndrome decreased, and convulsions did not recur. A noticeable improvement in the child's condition was noted from day 12. By this time, the trismus of the masticatory muscles disappeared and the child began to chew and swallow on his own. The work of the intestines was completely restored. The child had no complaints about pain in the muscles of the back and limbs, and his appetite was back. A month later, the boy felt well. Doctors strongly recommended vaccination against tetanus. Experts pay special attention to tetanus in newborns. Neonatal tetanus is a real scourge of newborns. The body of a baby who has just been born is completely defenseless against infections, and there are ideal entrance gates for bacteria on the body, the umbilical wound. Neonatal tetanus kills thousands of children every year, mostly in developing countries. Usually, the first symptoms of the disease appear on the 8th day of life. They grow much faster than in adults. Even with timely treatment, the prognosis is often poor. A number of factors increase the risk of developing neonatal tetanus. Among them is the lack of mother's vaccination. A woman in labor who has not been vaccinated herself is at great risk of contracting tetanus during childbirth. It is also dangerous to give birth in unsanitary conditions, at home, especially if there are pets. And also, folk methods of processing the umbilical cord, sprinkling with ashes, applying herbal infusions and decoctions, unsterile hands of staff, poorly processed tools. When ill, the baby refuses to be fed because it cannot suckle normally due to a spasm of the masticatory muscles. It has that very sardonic smile. The muscle spasm of the arms and legs occurs first from exposure to stimuli, bright light, touch, loud sounds, and then spontaneously. Newborns receive anti-tetanus antibodies from the mother through the placenta. This immunity is not permanent but may protect against neonatal tetanus. If a woman is vaccinated during pregnancy, immunoglobulins against the disease are found in the baby's blood. This indicates that active immunization affects the child. Aside from neonatal, the problem of maternal tetanus is relevant. This term refers to a disease that develops during pregnancy or 6 weeks after childbirth or abortion. It also has a more severe course and higher mortality compared to the ordinary tetanus. As preventive measures for neonatal and maternal tetanus, experts recommend vaccination of women of reproductive age and during pregnancy and childbirth in maternity hospitals in compliance with the rules of asepsis and antisepsis. To be continued in the next episode. Stay tuned.